Hello and welcome back to the Academy of Anaesthesia. In this video we're going to be going over the classification system that I use for antihypertensive drugs. As with all the high yield topics I've covered so far, this one comes up in both parts of the FRCA. Usually the question will be in two parts. The first part, the examiner will start off by asking you to broadly classify antihypertensive drugs. The next part will be on a specific drug itself. They could ask you about any drug relevant to anaesthetic practice, but remember that if the drug is obscure, the standard of knowledge expected by the examiner will also be lower. So don't spend huge amounts of time on learning all the pharmacological details of each and every drug, because frankly, that's impossible. The classification itself follows a very simple method. If you can remember the four organ systems, you'll remember it very easily. To start off, draw a nervous system, a heart, a vessel, and a kidney. We can broadly classify all the drugs into these four systems. Within the nervous system, you have centrally acting drugs such as alpha-2 agonists, which include Clonidine, Methyldopa, and Dexmedetomidine. They also have strong analgesic effects from this same mechanism of action. This group of drugs act on the presynaptic alpha-2 receptors in the brainstem, more specifically in the nucleus tractus solitarius. By doing so, it blocks the noradrenaline from being released presynaptically, and so reduces the effect of the sympathetic nervous system on the vasculature. The next group of drugs which act in the nervous system are ganglion blockers, such as Trimetaphan. This group of drugs block the activity of acetylcholine or nicotinic acetylcholine receptors in the autonomic ganglia. This reduces both parasympathetic and sympathetic activity in the body, but you can imagine, because of its extensive side effect profile, it's no longer used nowadays. Drugs that act on the heart include beta blockers, such as bisoprolol, atenolol, and labetalol. Labetalol has both alpha and beta activity. An easy way to remember this is that it has both A and B in the name. It's commonly used in pregnancy-related hypertension. Drugs that act on the vasculature include directly acting and indirectly acting vasodilators. Directly acting vasodilators produce nitric oxide, which activates guanylate cyclase. Guanylate cyclase then converts GTP to cyclic GMP, which then leads to vasodilatation. Examples from this group of drugs include sodium nitroprusside, GTN or glyceryl trinitrate, and isosorbide mononitrate. Sodium nitroprusside produces vasodilatation of both the arterial and the venous vessels, whereas GTN and isosorbide mononitrate produce vasodilatation of mainly the venous system. Next, you have the indirectly acting vasodilators. These reduce systemic vascular resistance and preload by various other mechanisms. This group of drugs include calcium channel blockers, such as amlodipine, alpha blockers, such as doxazosin, which antagonize alpha-1 adrenal receptors on the smooth muscle, and potassium channel activators, such as nicorandil. It also includes magnesium, which is a natural antagonist to calcium. Interestingly, nicorandil has a dual mechanism of action as both a nitric oxide donor as well as a potassium channel activator, so it should belong in both the direct and indirect categories. Another drug that acts on the vasculature is hydralazine. Hydralazine is a mystery drug. I say mystery because it acts on the vasculature, but the mechanism of action is still being debated. The proposed mechanism of action is that it causes hyperpolarization of the smooth muscle via potassium channels, but it also has other effects such as producing prostacyclin, blocking the release of calcium inside the smooth muscle, and increasing the availability of nitric oxide. So it's not clear which of these, or if all of them, contribute to its hypotensive effect. But it is a commonly used drug in pregnancy-related hypertension, so it is worth mentioning. And finally, drugs that act on the renal system include diuretics. These act by reducing the plasma volume, and some also produce arteriolar vasodilatation, reducing the SVR. Examples include thiazide diuretics or loop diuretics. There are also the agents that affect the renin-angiotensin-aldosterone system, such as ACE inhibitors like ramipril, or angiotensin II receptor blockers, such as losartan. To summarize, we've gone over the classification system using an organ-based approach. This includes neurological drugs, cardiac drugs, vascular drugs, and renal drugs. The extra details I mentioned may come up in the written part of the exam or in the second part of this Viva, where the examiner will ask specifically about one particular drug. But if you remember the overall classification structure, you'll be off to a flying start. It's helpful to know at least a couple of unique facts about the more common antihypertensive drugs we use. Thank you for watching, and I hope you found the video useful. See you in the next one.